Uses of n-acetyl cysteine, also called mucomist. The way I got involved with this drug is used, it's two indications as far as I know. One would be in an overdose of acetaminophen, Tylenol, paracetamol, or two, it could be used as a mucolytic. It loosens up mucus in your lungs. Someone comes in the hospital with an overdose of Tylenol. The acetaminophen gets broken down in the liver to toxic metabolites, and these metabolites use glutathione, and once they use up all the body's glutathione to neutralize these metabolites in the liver, it starts destroying the liver due to the free radicals created by Tylenol. So if you give n-acetyl cysteine, it gets broken down to glutathione, and when you have high glutathione levels, it can neutralize all the dangerous metabolites of the acetaminophen metabolites. It can also be used in a mist form. Respiratory therapists in the hospital could give it in a mist form to help loosen up the mucus in your lungs. And when you give it, I've been there when they've done that, and it smells like rotten eggs because it has sulfur in it. It's basically a semi-essential amino acid, so it's pretty safe. You can get it from onions, garlic, turkey, chicken. It comes in it's in your food. So n-acetyl cysteine, now, I've told about the two legitimate uses. Everything I'm talking about from this point on is not fully researched. I would not call it a sure thing, but it looks very promising, and there are studies that point that it is helpful. So n-acetyl cysteine gets broken down to glutathione in the body, and we know glutathione is an antioxidant. It helps the body remove free radicals or compounds that basically are missing an electron and want to take an electron, and they cause damage to cells and they kill them. So in your body, when you have normal oxidation, let's say the body wants to make energy. It takes sugar, it takes oxygen, and through the Krebs cycle, through metabolic pathways, it makes adenosine triphosphate, ATP, in the mitochondria, which is the energy of the cell, and it makes CO2. But what also happens, it makes an oxygen missing an electron, which eventually down the road becomes hydrogen peroxide moving around your body. And that's a problem because that's toxic to the body. So when you get n-acetyl cysteine, it makes glutathione, which then neutralizes this hydrogen peroxide. Now, what are the uses of that? It decreases inflammation. It can decrease the oxidative stress or the inflammation associated with exercise. It can, I've heard some people say, it prevents depigmentation of the hair from the hydrogen peroxide floating around your system. I've seen it, nephrologists have told me they use it when they use the dye, the contrast medium, to protect people from the toxic effects of dye that they use to study the kidney. The radiologists use it because it's nephroprotective. We know it protects the lungs. It protects the body from these toxic metabolites. But what else does it do? Why is a psychiatrist so interested in it? I'll tell you why. In bipolar disorder and schizophrenia, when they've studied it, they found low levels of glutathione. That means the body does not have the main molecule which protects it from oxidative stress or free radicals which damage cells. So if you go around with chronically low glutathione, it destroys your brain and your body. So the oxidative stress that it puts on it, causing inflammation and destruction of cells. So that's not good. It does this also by blocking interleukin-6. So we know in bipolar disorder and schizophrenia, it helps by increasing your glutathione level, minimizing the toxic free radicals, and blocking interleukin-6, which causes inflammation and damage. So prevents inflammation, prevents free radicals. Also, when you get n-acetyl cysteine, it gets broken down to glutathione, and then glutathione gets broken down to SAMe, S-adenosylmethionine, and that gets broken down to GABA, serotonin, and dopamine. So this is the n-acetyl cysteine downstream increases dopamine, serotonin, and GABA-aminobutyric acid, which is inhibitory. Dopamine is the reward neurotransmitter, the feel-good one, and serotonin, we know, treats anxiety and depression. So what does this do in gambling? They postulate, now nothing's in science, that it supports dopamine. So people who are gambling are looking for that dopamine high. This helps modulate dopamine so they get that, and they don't get that feeling of lacking dopamine. Also, there's speculation in gambling and addiction that there's elevations of glutamate. Glutamate is an excitatory neurotransmitter. It makes you have anxiety, angst, desire. So someone who's craving has that restless anxiety, tension, and it's at higher levels, the glutamate becomes neurotoxic. So what the glutathione does is it lowers levels of glutamate. So that would minimize the effect, the excitatory, anticipatory anxiety associated with drug craving or the need to gamble. It will minimize that effect by minimizing glutamate. That sounds good. So we could see that this has effects in bipolar disorder, schizophrenia, by decreasing the oxidative stress of inflammation, by decreasing interleukin-6 and increasing glutathione levels, which are responsible for cellular damage, low levels. So it increases it. It also may increase dopamine, serotonin, and GABA. That would help bipolar disorder and schizophrenia. It can be possibly used in gambling, obsessive compulsive disorder, and it could be used in obsessive compulsive disorder, bipolar, gambling, and addiction. There's also a study I read in Iraq. They did it on veterans who had head injury, and they gave them like 5 grams after the head injury, and the complications from that head injury were less. So that's hopeful. What's the dose of this? I think it's unclear. I think a maintenance dose, a reasonable maintenance dose, would be 600 milligrams twice a day. Nothing's written in stone. That's not science. This is not fully documented. But I would say 600 milligrams a day would probably be a good start. During an active phase of illness, go to 1,200 milligrams twice a day. It can also be used in COVID because it has immune functions. It actually increases the activity of natural killer cells, which kill bacteria and kill viruses, and it increases macrophages, which gobble up pathogens like viruses and bacteria. It also has beneficial effects on your skin. Some people say it may help with gray hair. It definitely increases inflammation. So if you work out a lot and you're inflamed, it helps. I take it. It seems to help me. I'm not giving anyone any suggestions to take it, but I do recommend it for my patients with bipolar disorder, schizophrenia, and depression. 600 milligrams twice a day. I think it could be very useful. I'm at the preliminary phases of recommending it. For sure, it would be used to protect lungs as a mucolytic and for overdoses of Tylenol. Tylenol is the #1 reason people overdose in the United States. Acetaminophen knocks out your liver. How much? 10,000 milligrams or 10 grams. That's 20 extra strength Tylenol tablets. That's not that much. And if you drink on that Tylenol alcohol, that 10,000 milligrams goes down because the hepatotoxicity occurs at a lower dose. So don't take a lot of Tylenol. It's very toxic to the liver. It also says something interesting. It's also involved in the clotting cascade. It prevents platelet aggregation and prevents thrombosis, especially in COVID, but also in other states. It's through a mechanism of, I forget the actual mechanism there, but it has to do with preventing platelet aggregation and causing deep venous thrombus. So in COVID, they think it can help by decreasing mucus in your lungs, by enhancing the immune system through natural killer cells and macrophages, and by decreasing inflammation in the body and preventing clots. So I think this is a valuable thing to take in COVID. It's valuable to depression, bipolar, schizophrenia, addiction, and OCD. So I definitely use it in my psychiatric practice. Thank you. I appreciate the likes. I need more subscribers. And hey, my book's on Amazon.com. I appreciate any comments. I hope biochemists out there don't beat me up too much on today's talk. Thank you. Dr.